5 minutes after 11 o'clock. Thank you for tuning in. All right. I don't know how good you sleep, how well you sleep. But I think I found the answer to my insomnia. The answer is to get the dog's fleas taken care of. Because when she stopped scratching, I slept so good last night. Dr. Grodonoff Nelson has been with us before. He's with us again with the beautiful Brittany Marthaler, who was out picketing this morning for United Way.
Yes, she was. We thought we'd have to, bail you out of jail.
Still wearing your Live United T-shirt. Brittany is the communications manager at Ocala Health, and Dr. Nelson is the primary care provider with family care specialists. So good morning to both of you.
Good morning.
Good morning.
Do I have your microphones on? Yes, I do.
Yeah.
Oh, thank you for coming in, doctor. And I was kidding, but here's what I'm not kidding about. When my dog, I took her to the vet yesterday, so she didn't scratch at all last night. It's wonderful. I slept so much better.
That's good.
Yeah, but here's the thing: whatever causes insomnia, it is crazy. You can't get through the day. I literally will. And we'll see if it's different today. But I would get done with the show, which is at noon. I'd be in production 1 o'clock, and I'd be falling asleep at the computer.
Exhausted, yeah.
Yeah.
But he gets up at 3 in the morning.
Yeah.
3 a.m., so.
You have to make sure you get adequate amounts of sleep.
Yeah.
So that's what you're here to talk about today is insomnia.
Yes.
Right?
So insomnia is a disease state that has, it's multifaceted. There's a lot of different things going on that could cause insomnia. The main thing is to make sure that you define insomnia properly and to diagnose it properly the best you can. I mean, if you're having one or few days here and there where you're having difficulty falling asleep,
right,
due to the dog or something, you get the dog taken care of, then you go to sleep. That's not really insomnia. Insomnia is more so if you're having difficulty falling asleep, staying asleep, where you're spending the whole night thinking that you're asleep, but you're still not well rested, or the fact that you're having daytime impairment because of the fact that you're not getting enough sleep. So depending on what's going on, some individuals, they have issues staying asleep because of arthritic problems they may be having. So
pain.
Sometimes it's not just insomnia by itself. It could be something that's causing the insomnia. So we have to figure out what's going on. Sometimes the individual may be depressed. That may be contributing to their insomnia. Sometimes they could be mourning, for the death of someone or broken relationship or something that could be.
Really? So this sounds like an area of medicine that is hugely psychological.
Yeah. I mean, the thing is that the top 3 complaints patient come into our office, one of the top 3 is insomnia. So it's big. So
I can't sleep. Are they saying I can't sleep because my leg hurts? I can't sleep.
Not necessarily. Sometimes they say, "Doc, I just can't sleep," and it's up to us to figure out what's going on. Is it, are you having some other type of issue that's contributing to your lack of sleep? How's your sleep hygiene? That's very important. Some individuals, they bring their work to bed. They have, books, they're studying.
I don't do that ever.
Or their computer, or, their...
I never bring my work to bed.
Yes.
I love that sleep hygiene. I love that phrase. It's a great phrase.
Do you know what I can imagine is dangerous, though? And good for the patients who came to you with the problem, because I'm guessing the danger is we try to diagnose it ourselves and then medicate it ourselves. You go to there's 100 different pills at the pharmacy that say sleeping pills.
Yes, and some individuals try to self-medicate, and and sometimes it's a complete failure. So that's why it's important to figure out what's going on, what causes them to have the issues where they're not falling asleep or not staying asleep. Sometimes their circadian rhythm could be completely off. We have some shift workers, police officers or first responders, nurses, where they're working all night for a few nights and they switch to days. So that could be an issue too, where hey, I'm not falling asleep, or I'm having issues staying asleep. So it's very important for us to figure out what's going on. And the thing is, we find that about 50% of the elderly 65 years and above have issues with insomnia. So it's a
I
really
got 5
big,
years.
So if you put a room of 10 individuals at 65 years and above, 5 of them have difficulty falling and staying asleep, or have some sort of insomnia, either primary or secondary to something else.
Well, they just don't want to miss life, though, because in the early mornings, that gives one kind of demeanor about a person, and then at nighttime, they might like to go out and just socialize with people.
Well, that's fine, but at the same time, the issue is some individuals, their whole sleep cycle is off. Because with sleep, there's different cycles when it comes to staying asleep. There's the non-REM sleep, non-rapid eye movement stage, and there's the rapid eye movement stage, which would be the 5th stage. So there's 5 whole stages of sleep. The first 2 stages deal with you initiating sleep. Kind of you're still a little awake, like if the dog barks and you get up.
Yeah.
Just a little movement. Then or the kid, nudges you if they're in bed with you. Then you could wake up. That's stage 1 and 2. When you start getting into stage 3 and 4 is when you get into the deep sleep. So that's when you're really falling into a deep stage of sleep. It's 3 and 4, and then stage 5 is a rapid eye movement. It's a dream realm, so to speak.
Really?
So that's where you're dreaming. Your body becomes kind of still. You're breathing more deeply. Now you're into really deep sleep, and for the most part dreaming. Even if you don't remember your dreams, but for the most part, when you're in REM sleep, rapid eye movement sleep stage.
I'm anxious to hear what the treatments are for this, because you hear a lot of wives' tales or folklore, things like that, right? So I want to hear some. But we do have a phone call. Are we okay with taking phone calls, Brittany? Okay. If you can put your headsets on and make sure you can hear me, then you'll know that you can hear the listener. Can you
Yes.
hear me? Can you hear me? Okay. Good morning. Thank you for calling and for waiting. You're on the air.
Yes, thank you. Has hypnotics ever been tried to help with insomnia?
Yeah, they're always saying you're getting sleepy. All those hypnotists.
For some individuals, depending on what's the cause of the insomnia, that's why I always say it's important to figure out what's happening first. So I don't just want to label somebody as, oh, you're an insomniac or you have insomnia just because you're saying, hey, I have issues.
So it's a big difference between, okay.
So that's why it's important to figure out what's going on. If it's just purely insomnia as the primary reason, then we could look at different treatment options, and sometimes if certain things don't work, hypnotism could be something that could be tried as well. That's why I never rule out anything off the table.
Some things could work, yeah.
But at the same time, getting to the root cause of the problem is important.
So, but if I come to you and I just simply say, gosh, sometimes I have a hard time falling back to sleep. Like, let's say the dog wakes me up. I get up at 3, which means I go to bed at 8:30. So if I get up at 1 with the dog, I still have 2 hours I can sleep. Sometimes once I'm out with the dog, and that last last 2 hours is hard. Yeah. But that's not insomnia, right? That's just
not necessarily
the dog.
I mean, if it's happening every night, because some individuals, regardless, dog or no dog, they just wake up in the middle of the night. That's something else. If you're being woken up by the dog, or your kids are crying in the middle of the night and you have to get up.
Well, you want to be able to wake up for that.
Wake up, but if it's something that's happening, consistently every night, you're getting up, at 2 a.m. You go to bed, you try to go to bed at a decent time, and every night you're only getting 4 hours of sleep. Then we need to figure out, what's going on, what's causing you to get up in the middle of the night. And every individual is different. That's why I don't want to just blanket it as, okay, if this is happening to you, then we're going to do this. For the listeners out there, we have to figure out what's the root cause, what's causing you to get up, because if you're not getting sufficient amount of sleep, it leads you to other disease states. Hypertension is something that could be linked to lack of sleep. Depression, if somebody's not getting enough sleep, they could end up becoming depressed. Right. It's something that needs to be addressed. And it could also impair your function at work, your function at school.
Oh, absolutely.
So a lot of times we find that, especially in the youth, if they're not getting enough sleep, they're at risk of having a car accident. So making sure that you're completely alert, during the day is, of high concern, and we need to get that addressed by allowing you to have sufficient amount of time to sleep.
So that's totally different than when a new baby is born, to try to train the babies to sleep during the nighttime hours. This is totally different than trying to train babies. You can't really train adults.
I mean, the thing is that It just depends, because some individuals, they want to get babies to sleep during the night, so they wake them up during the day. It's more so the parent could be asleep.
Get them to run around if they're old enough to run around, play.
Yeah. So you could be able to be exhausted and have them go to sleep, so you could be able to get some sleep.
All right, we'll take a little break. We'll take a little break and be right back. If you have a question for Dr. Nelson, go ahead and call. You'll be on during the break. You'll be on hold during the break, and then you'll be on. 622-9622. We'll be right back.
The weather is brought to you by myfwc.com. Safe boating is no accident. The flood watch is in effect for coastal counties through late tonight. It'll be mostly cloudy today with a couple of showers and heavy thunderstorms. Watch for localized flooding, the high 81 to 85. Mostly cloudy tonight with a couple of showers and a heavier thunderstorm, low 69 to 73. For tomorrow, variable cloudiness with a heavy thunderstorm or two around, the high 83 to 87. From the Florida Weather Center, I'm meteorologist Joe Lundberg.
Good credits, bad credits. It's none of our business because we're not an auto dealer. We're not a bank. We're not your mother. We're OcalaForSale.com. Marion County's marketplace for cars, trucks, and SUVs. We've got thousands of sellers standing by to take your call. No middleman. But hurry, don't walk, don't run. Just sit down and log on to OcalaForSale.com. Prices and inventory change daily. Offer does not include dealer upcharge. Undercutting, rust proofing, factory surcharge, or delivery fee. See website for details.
Do you have areas that have started sagging or drooping? Is what you're looking at not quite the same as it was years ago? Are there enhancements you've been putting off? Is there serious damage you need fixed? Then call on us, Damage Control Services. When your roof is sagging and the drywall is drooping after a storm, or your home just needs some enhancements, from damage repairs to new construction, Damage Control Services is here to help.
Hi, I'm Leah Caruso with Strive Rehabilitation, inviting you to join me Thursday at 11 a.m. for Health Matters. Ocala Health and Strive have teamed up to bring you the latest information on good health services available to you right here at home. This vital information will help you make informed decisions about your health. So don't forget to join me here at 11 a.m. Thursday. It's news you can use from Ocala Health, Strive, and your friends here at WOCA.
Hi, I'm Seth with AA Lock, Dock, and Security. Have you ever thought about the locks or security on your house or business? Have you ever wondered why the keys to your new car cost so much? Well, at AA Lock, Dock, and Security, we can help with securing your valuables. We can even replace those expensive transponder keys. We can give you the knowledge that no one else will. Call AA Lock, Dock, and Security at 867-1965. That's 867-1965.
One of the most common questions those nearing retirement are asking: will I outlive my money? Retirement questions like these and many more will be answered every Saturday morning at 9 a.m. on Planning for a Better and Safer Retirement with hosts Francois and Julian Pozenet. Francois and Julian will help you put your retirement puzzle together. Catch Planning for a Better and Safer Retirement Saturdays at 9 a.m. on Ocala's News Talk, The Source 96.3 FM and 1370 AM.
All right, 19 minutes. We're talking about dreams actually during the break. So here's a question, I guess, about sleep. Are dreams important? Like you said, dreams happen in the deepest level of sleep. Does that mean dreams are important, or just that's when it happens?
Yeah, I mean, dreams are important. Even if you don't remember your dreams, like some individuals say, I don't have any dreams. Well, just because you can't recall them doesn't mean that you're not having dreams. The thing is that dreams occur in stage 5 after the deep sleep cycle, and that's where you have the rapid eye movement that's going on. But the thing is that the brain is functioning now. I mean, the brain is always functioning throughout the whole day, of course, but at this time is when the brain is getting rest and the brain is just constantly going, and it creates these dreams to kind of keep itself engaged in a sense. So dreams are important. For the most part, everybody has dreams, but the thing is that sleep cycle is important for the patient to maintain, because the thing is that as you get older, increase in age, especially above 65, you have less of the stage 3 and 4, the deep sleep, and you have longer stage 1 and 2. That's why some elderly individuals complain of anything will wake me up. they're
Why
very light
65?
sleepers. Because that's when you start
Deteriorating.
not necessarily.
Maybe it's because we stopped working. Maybe we need to be out digging ditches.
And the thing is, sometimes they note that retirement could affect a person's sleep. Because if they're so used to working, have a certain schedule,
That's it.
now they don't. Now it kind of throws everything
I'm
off.
going to be a farmer when I retire. Then I'll be out there working all the time.
Yeah. What about people who are blind?
Those individuals also, of course, even though they're unable to see, but they still go through the same sleep cycles, they dream as well. So it could be a bit different, but they go through the same cycles like everybody else.
That's an interesting question. I wonder if somebody who was born blind has visual dreams.
And I mean, based on the research that I've heard and read, they still have visual dreams. The thing is that
Really? So
I mean, different. It may not be the same as you that seeing that you see like the sunrise, sunset, and things. But note that they have other senses as well. So they're able to hear things. They're able to smell things, feel things. So it may not be. Not everything is just visual. So imagine somebody that could only see and not have any other senses that have some difficulty doing a few things as well, including it'll probably contribute to their sleep state and also their dream realm, what they experience.
So somebody who's chronically or clinically, I don't know which word would be appropriate here, losing sleep, that's insomnia. Is that how you define insomnia?
Yeah, so the thing about insomnia, there's 3 different ways to officially say somebody has insomnia. One of which is, are they having difficulty staying asleep? Are they having issues falling asleep? Are they not feeling well rested or refreshed even after a long night of attempting to sleep?
Right.
And then are they impaired because of the lack of sleep? So sometimes an individual says, hey, am I suffering from insomnia because I only get 6 hours of sleep, with my wife, if she doesn't get 8, she's cranky. Well, everybody's different. Some individuals, they require, I need 8 hours of sleep or I'm a complete mess.
How come men fall asleep after sex? Sorry.
That'll be a cure.
What happens there? I saw this happen to an elephant. I went to the Jacksonville Zoo, and everybody was watching. I wasn't the only one, but there was 2 elephants together. And when they were done, the male elephant lay down. I said, I do the same thing.
So I mean, the thing is that with mammals, especially, there's what's called parasympathetic and sympathetic. So, with the sympathetic, it's kind of like the fight or flight type of reaction that you have, and the parasympathetic is a relaxing mode. So when you, for example, when you ejaculate, that's when you have the sympathetic, and then right after that, you have the parasympathetic. So you're in complete relaxed mode.
I never think of those words at that time.
Before medical school, I didn't think of it. And afterwards, you're like, oh, okay.
Right now, I'm being a little parasympathetic.
Are you going to think of them now, those words?
No, I doubt it.
Yeah, you don't think about that when you just see the elephants. You're like, wow. That's all you really think about.
That is the word I thought was wow. I thought, wow, that was something. We're being silly. So give us some therapies. I heard one. Does this work? If you can't fall asleep, push your belly out as far as you can, like you're trying to pop the belt, and you won't be able to do it 10 times, and you'll fall asleep. And I've actually tried this.
Really? Does it work?
Just push your belly out.
Do you fall asleep?
Yeah.
Oh.
But of course, I fall asleep pretty easy.
Yeah, maybe you just get bored.
Yeah.
You completely exhaust yourself, and then you just cause you to go to sleep. I mean, possibly, and I haven't heard that, and as a treatment, but if you cause yourself to feel completely exhausted by doing those maneuvers, then you could probably. It's kind of like, sometimes we tell individuals, like I mentioned before, the whole sleep hygiene, and we try to go simple. If you come in, you have issues falling asleep, then we say, okay, let's work on your sleep hygiene. I kind of get an idea of what's going on at home in the bedroom. So sometimes some individuals are really busy and they have a difficult time winding down, or they take the time right before they go to bed to think about all their problems throughout the day.
Yeah,
and sometimes you just have to let go and remove that.
Ruminating on everything
exactly.
from the day.
Mm-hmm.
Yeah.
So sometimes you just have to go ahead and work on your sleep hygiene. Figure out, okay, I'm going to go take a shower, brush my teeth, turn off all the lights, turn the TV off.
Oh, yes.
Eliminate any distractors. Put the tablet away because sometimes the tablets could really affect us. Get all the kids to go away. Get the dog out of the bed if the dog is really bothering you, and really try to have a good process for you to go to bed. So sometimes just by doing that. That helps.
That would help, yeah.
There are commercials on television and on the radio about those different kinds of beds and mattresses and things.
Oh, yeah.
Sometimes a person will, put money into that and get that, and psychologically they'll think that'll help. Does it really help?
I mean, sometimes if let's say you have an old mattress and the mattress is hard, you're uncomfortable, you're shifting, and you just can't really get in a good comfortable position. Sometimes by getting a better mattress. You'll feel more comfortable and get some good amount of rest. Some individuals, regardless, that's not the problem. The problem is not that. Sometimes it's arthritis. They have a bad shoulder, not really getting that addressed. They'll shift over on that side. The shoulder will hurt, and sometimes it won't really wake you up in the middle of the night, but it hurts. So subconsciously, you're shifting throughout the whole night. Bad knee. So sometimes it's important to get to the root cause, because by controlling the pain, you'll be able to get a better night's rest because you're not constantly shifting.
Are you old enough to remember waterbeds? I know, Brittany, you don't remember waterbeds.
Yeah.
I do.
You do? Did you like them? I hated them. Oh, it was the worst.
My daughter had one. She liked it.
I don't know. It was a different experience, I guess. I've been in one before, but I didn't have that as like my primary bed. But
Right.
I do remember.
Really? It seems like they became
were
extinct.
around in the
They needed to be
80s and
extinct.
90s.
Did you
my
like-
daughter had one.
Did you like them?
I didn't like them. I mean,
Yeah, me either.
Yeah. Some people, different people, different things.
Yeah.
Sometimes it's the fad that they.
Do you know when I worked the night shift? What I did was I put aluminum foil on the windows to make it, because I was sleeping in the daytime, so I had to make it dark, and then I would put the fan on for that noise, just to kind of drown out any outside noises.
And sometimes that helps, making sure that you have good ambient sounds. So different people, different things.
Yeah.
Depending on if you work, like I said, night shift, get blackout curtains. If you're gonna sleep during the day.
Oh, like a hotel.
Yeah.
Don't you live in a hotel? They got those thick curtains.
so-
They put the air conditioner on really cold.
Yeah. What about temperature?
Because some individuals, if they're really hot, they're not comfortable.
Oh, yeah.
So they can't fall asleep. So it's important to keep the room in a comfortable temperature, and make sure that you eliminate any distraction at all. And the bed, we only said the bed should be used only for two things. It should be used only for sleep and intimacy, and that's it. I mean, you shouldn't.
I didn't know what word you were going to use.
I know, me neither.
So only two things that the bed should be used for, and you shouldn't be bringing anything else into the bed. It's just gonna impair.
Has anybody ever said
sleep.
to you, I do have a third thing? Does anybody ever bring somebody ever say to you, I do play pinochle or something in my bed, or?
Well, they need to stop. If
You're fun. Okay, so Brittany, do you have actually any classes for this? Do you have any clinics for insomnia?
No, we
No?
don't. We do talks on them from time to time. And you can find out about any of our upcoming talks on our website at ocalahealthsystem.com or by calling our free referral line at 800-530-1188. And if you'd like to get in touch with Dr. Nelson's office, the number is 352-351-0120.
We've had fun with the topic, but it's a real serious topic. If you're not getting enough sleep, it's a big health problem, isn't it?
Yeah. It's a top health problem.
I'm going to try to squeeze in a question, but this has got to be really quick because we're at the very, 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 very end, like 30 seconds. Can you squeeze in a quick question?
Actually, this is a statement.
Okay.
I bought a waterbed, a semi-motionless one,
Yeah.
because I had a hip surgery. Best thing I ever did. I slept like a baby, no joint pain, no nothing, like a mattress will give you. So don't give up on waterbeds. They're really great if you've had an injury.
All right.
Thank you. I love the show.
Thank you. Thank you. That was fun. Thank you so much.
Thank you for having me. Appreciate it.
Fox News Radio, I'm Lillian Wu. In the GOP presidential debate on CNN last night, some of the sparring was over speaking Spanish. Donald Trump standing by his criticism of Jeb Bush for speaking Spanish on the campaign trail.
We have a country where to assimilate, you have to speak English.
Marco Rubio weighing in that his